Okay, let's start. Our training today about the basic principle of radiation protection. I'm Dr. Islam Kamal. I'm a medical physics consultant, board certified PhD in medical physics, working as a radiation safety expert and medical health physicist in Pittsburgh University, United States of America. So let's start our outlines today. We will talk about radiation we live with. Do we need radiation protection? What can radiation do? Main principle of radiation protection. Okay, if I ask you, is there any radiation in this room? For sure, there are many sources around you, but not all forms of radiation are harmful. But radiation, you cannot smell it, you cannot touch it, you cannot hear it, you cannot see it, except a certain range of radiation in visible light. So your cell phone already emitting radiation, your laptop emitting radiation, the ground floor and ceiling, walls, so radiation everywhere. Even your body also contains a certain amount of radioactive material, which is called potassium 40. This potassium 40 is the highest concentration activity of radioactive material inside your body. So if you are eating rice, milk, beef, or fish, okay, that's meaning your body contains a certain amount of radioactivity. The highest concentration activity of radioactive material is potassium 40. The percent of potassium 40 which is radioactive is 0.01% of normal potassium. So if, for example, if your weight is 70 kilograms at that time, your body contain around zero point 0.1 microcurie of potassium 40. So time half-life of potassium 40 is 1.3 billion years. That means your body contain a certain amount of radioactive material which emitting 89% of beta particles and 11% of gamma radiation. And this potassium 40 already emitting 24,000 photons emitted per minute. So your daily intake of food like rice, wheat, pulses, vegetables, milk, all of them contain a certain amount of radioactive material. The highest concentration one is potassium 40, as you can see here. This is the highest concentration of radioactive material. So you get a total dose from natural sources from 1 to 3 millisievert per year. Also, if you are living in India or UAE or Brazil or different countries, so based on the nature of the country itself, you will find the background radiation because it depends on the nature of the country if there are a lot of mountains there or not. Based on the mountains, you'll find different radioactive sources there like thorium, uranium. So these radioactive sources, which is called natural radioactive sources, already emitting radiation, so it increases the background radiation. That's why when you measure with using cervimeter, you find reading because there are natural soil around us. So we get, if you are living in India, from India, for example, you get 0.01, 0.079 microsievert per hour. Okay, incomparable with Iran, which contain a lot of mountains there. So the background radiation will be 1.1 for microsievert per hour. In Brazil, 1 microsievert per hour. So based on your country and nature of the country, you will find the background radiation differ from one to another. Here in UAE, United Arab Emirates, you will find the background radiation is around 0.033 microsievert per hour. Also, when you are traveling from your country to another country, if you are monitoring your monitor, okay, in front of you, you'll find yourself at a certain height, 15, maybe reach to above 15 kilometer, above 15 kilometer from sea level. So at that level, you will get 10 microsievert per hour. So if your flight takes around 3 to 4 hours, so that's mean by end of the flight, you will get 40 microsievert per hour. The highest percent or the high percent of 55 of radon gas which coming from natural background radiation, and you'll find radon gas coming from ceramics, porcelain, and come from wall ceilings. This radon gas already given us around 55% of natural radiation or the received dose from all source of radiation around us. So now the main question we have, do we need radiation protection? Actually, from the accident happened in medical field, okay, we this accident enforce us to go through the radiation protection rules and follow radiation protection guidelines. So as you can see here, you'll find this patient already suffered from hair loss and skin redness. That's why, because he get exposed to 3 to 4 gray as an absorbed dose, because he did CT perfusion techniques, okay, to detect the circular fields, blood flow. So at that time, he got high level of radiation because of the improper use of the protocol or the machine itself. So it caused highly deterministic effect of radiation, which caused hair loss and scaredness, as you can see in the image. Also, another example for deterministic effect of radiation for after fluoroscopy procedure for cardiac angiography, you find patient suffering from tissue damage or skin burn, as you can see here, which reported by ICRB 85. So these patients already followed up after 6 to 8 weeks from the procedure itself, and this patient already followed up after 18 months after procedure. So as you can see, you find tissue damage, skin damage because of the improper use of the machine, and the operator themselves, okay, didn't optimize the dose for the patient. So at that time, the patient get this problem. So here, ICRB recommend to warn the patient if the maximum skin dose exceeds 3 gray, identify patients who have repeated interventions where the dose exceeds 1 gray, and warn them of risk. Not only patients, but also we have the workers themselves, IRs, interventional radiologists already some group of IR already suffer from cataract. Why? Because of the scatter radiation is very high because of the improper use of the machine. At that time, the scatter radiation, because of interaction between the radiation coming out from its tube and the patient himself, a lot of scatter everywhere. So all the stuff around the patient during the procedure itself will get exposed to the scatter radiation. So the eye, as a sensitive organ inside our body, so it will receive a certain dose of radiation which might cause cataract for them. Now, as we can see, we get hazard, we get problem, so we need radiation protection. What can radiation do? Radiation can cause death, cancer, skin burn, cataract, infertility, genetic disease. So many effects of radiation. We have a wide spectrum of effects of radiation based on the dose itself and the age of the patient. So let's talk about the main principle of radiation protection. Actually, for any medical facility, we have three categories should be protected from the radiation hazard. First one is called medical exposure. Second one is called occupational exposure. Third one is public exposure. Medical exposure contains the patient and comforter and carer to the patient himself. Occupational exposure including all workers, okay, working with the radiation field. And public exposure for members of the public, such as waiting rooms or your colleagues working in another department. So the three main categories should be protected from radiation hazard in our facilities. How can I protect the patient and worker and public by ICRP principle? ICRP, International Commercial Radiation Protection Principle. Three fundamental principles of radiological protection: justification, optimization, application of those limits. First one is the justification. Justification means you have to make the balance between risk and benefits. Okay, I have to get high benefits more than risk to the patient. So applying justifications, that's important, as FANR inspector, Federal Authority Nuclear Regularity Inspector, will come and ask you, and this is the main role of our doctors and our radiologists. They have to justify the case itself if it's required to go through CT or X-ray, or instead of that we can do ultrasound or MRI. So we have to justify the case if it's needed or not, indicated or not, so we can guide the patient to the proper procedure. So justification should be documented, should be recorded, and should be uploaded to the patient file. When final inspectors will come to your department, they will ask you definitely about justification SOPs and the report or the documentation for justification procedure. So keep that in your mind. Optimization of protection and safety, that means we are reducing the acquisition parameter, we are reducing the patient dose to get optimal diagnostic image. And this is the main role of our technologists and our radiographer. They have to make sure that they are using the lowest radiation dose to the patient and to get the optimal diagnostic image. For limitation of doses, you ask yourself if there are any limits for patient. No limits for patient. Actually, we are following diagnostic reference level. Diagnostic reference levels means there are a list or a table which published already in final regulation 24. So at that time, you can find for each procedure you will find a certain value which is called diagnostic reference level, which give us information about the patient dose. It's a dose quantity. So you can follow this one. This is important for all radiographers, all technologists to monitor these doses and to follow and to compare their results with this one. But actually, we don't have limitation. You cannot say this patient already did one or two or three X-ray before, so I cannot do more than this. No, you cannot do that. But you have to justify the case, and if it's necessary, and you are saving this patient life, so you have to do the procedure. For public and workers, okay, definitely we have limitation of doses. That's important to be applied for all public and workers as well. Okay, this part is clear for everyone.
Yes.
Okay, great, perfect. Okay, types of radiation. We'll talk about the types of radiation. Actually, there are around us many types of radiation, but all of them under electromagnetic radiation or electromagnetic waves. So you will find electromagnetic waves which is combined between electric field and magnetic field. Both of them together combined together, which is perpendicular to each other, and these electromagnetic waves classified to ionizing and non-ionizing radiation. So if I ask you about your CT machine, X-ray machine, or gamma camera or PET CT, so at that time we are using ionizing radiation. So all machines containing X-ray or gamma ray, so at that time it it's following ionizing radiation as it has enough energy to knock out electron from the atom. So if the radiation has enough energy to knock out the electron from the atom, so it's called ionizing radiation. But if the radiation has not enough energy to knock out electron from the atom, so it's called non-ionizing radiation. I can give you an example for non-ionizing radiation like magnetic resonance imaging, MRI machine, radio waves, TV, mobile tower. So cell phones. So this type of non-ionizing radiation has low energy, low frequency, high wavelength, cannot cause any ionization. While ionizing radiation, like X-ray machines, fluoroscopic machines, CT, CBCT, all machines we have used for imaging. So it's ionizing radiation. Okay, so the radiation itself, it's energy. The radiation itself is energy. Okay, it can be converted from one form to another. So now we are talking about radiation, so we are talking about electromagnetic waves, so we are classified electromagnetic waves to ionizing and non-ionizing radiation. So ionizing has high energy, high frequency, low wavelength. Radiation itself, it's like a wave. Okay, so now if I ask you what's the distance between this peak and another peak, this is called wavelength. Okay, so by increasing the frequencies, that means we are increasing the cycle per second. So increasing the frequency, which means number of cycles increase per second, so the energy increase. So if you are increasing the energy, you are increasing the frequency, so the distance between two peaks becomes shorter, so the wavelength is less. That's why ionizing radiation has high energy, high frequency, short wavelengths. While non-ionizing radiation, like that. So low frequency, low energy, and the distance between two peaks or two bottom, which is called wavelength. So that's mean it's long. So non-ionizing radiation has long wavelength. So now, if I ask you, okay, what about the ultrasound waves? It's ionizing or non-ionizing? What do you think? Okay, actually, ultrasound wave is not. It's none. It's not non-ionizing or ionizing. None of them, because ultrasound wave is a mechanical waves. It comes from vibration of crystal, which is called piezoelectric material. So it's a certain type of waves which needs medium to propagate through it. While ionizing, non-ionizing, no need for any medium. Okay, so someone asked me one day, I have to wait for 5 minutes after switching off the X-ray procedure. Why? To let the X-ray to disappear from the room. That's crazy. That's funny. Okay, as X-ray or gamma ray already moving with 380,000 kilometer per second. This is the speed of light. Do you think you will catch any photon or any radiation after the X-ray procedure? It's impossible to do that. So feel free to go inside the X-ray room after doing the procedure. There is no radiation inside. Once you switch off the machine, that means X-ray disappear. Okay, so the atom itself, as we know, so the atom itself is composed of nucleus. Inside the nucleus, you will find the proton, positive charge, and neutrons, which has no charge. And around the nucleus itself, you will find the electron has negative charge. So the ionization means that the radiation coming out from outside, knocking out the electron to knock out from the atom. And at that time, it's called ionization. Okay, here gamma photon, free electron knock out from the atom, so it's called ionization. Okay, so interaction happen between ionizing and our balls or non-ionizing our balls. As you can see here, the ionizing radiation interact with your body and cause many ions to produce inside your body, which is called free radicals. While non-ionizing radiation doesn't cause any free radicals production. So the only issue now we have free radicals inside our body. Those free radicals already attack our DNA to cause damage. And if this damage not repaired, so it might cause cell death or cancer. We'll talk later in details about the biological effects of radiation. Okay, so this is our DNA, okay, which contain all genetic information, okay? So at that time, interaction between X-ray and gamma ray and the DNA itself, so it caused DNA damage. So this DNA damage might cause mutation or cell apoptosis. Actually, we have different types of radiation according to the source. Man-made source, natural source. If we are talking about gamma rays or alpha particles or particles, actually we have waves and particles. If we are talking about gamma rays, so we are talking about wave. X-ray, we are talking about waves. While alpha particle, beta particle, neutrons is particles of radiation. But gamma rays, alpha particle, beta particle is a type of natural source, okay? We cannot produce gamma ray or we cannot produce alpha particle or beta particles. We cannot do that. But it comes from the atom itself, or it comes from due to nuclear procedures, okay? So that's why it's called natural source of radiation. While man-made source of radiation, we have different X-ray machine, fluoroscopy, dental X-ray, linear X-ray, computer tomography, mammogram, CBCT, all other sources using man-made source. What does it mean by man-made source? You can control it. You can switch it on. You can switch it off. It's safe to go inside if there is no radiation. It's safe to go inside the X-ray room if you switch off the machine. So no worries about that. While if we are talking about gamma ray or alpha particle, beta particles, we have radioactive material. We have atoms which is radioactive. This atom already injected inside the patient. So at that time, the patient himself become radioactive, become shining, become emitting radiation everywhere. So you cannot switch it. It switch the patient off. You cannot do anything. You can control the patient. Just only you have to wait for a certain time based on the time half-life of this radioactive material to let all radioactive material to be washed out from the patient. At that time, you can deal with the patient freely. Actually, in the man-made source of radiation, we have the X-ray tube. This X-ray tube is the sensitive part or the most important part in our machines. The X-ray tube itself, it contains the cathode and anode. As you work as a radiographer, you are adjusting the X-ray parameters, you are adjusting KV, or adjusting mass. So at that time, when you are increasing the KV, you are increasing the kinetic energy of electrons moving from the cathode to the anode. At that time, you are increasing the intensity of X-ray. So the patient dose will be double. So by increasing KV, you are increasing the kinetic energy of electrons coming from the cathode towards the anode. So you are increasing the received dose to the patient. So be careful about that. Don't use high KV with small patient, moderate sized patient, or child. Use only low kV in certain range, 80 to 100 maximum. For a child, you can use 80 kV, that's more than enough. But in obese patient, you can use 100, 120 kV, especially for X-ray. I'm talking about CT, computed tomography. Okay, so you have to play with that. This is a part of optimization techniques, and this is the main role of our radiographers and our technologists to play with that and to adjust the low dose with patient and getting optimal diagnostic image. Okay, so moving the electrons from the cathode towards the anode interact with the anode at that time in two different processes. One of them is called Bremsstrahlung X-ray, and the other one's called characteristic X-ray. The interaction happen between the electrons and the anode. If the interaction happen between the electrons and the column field around the nucleus, so the electrons will be deflected from its path, so it will produce radiation or a certain type of radiation which is called Bremsstrahlung X-ray. While interaction happen between the electrons in the orbit around the nucleus, so it will knock out the electron from the atom and another electron will come from higher level to fill the gap. So a certain type of radiation will be produced as a difference in energy between different ground state or different energy state, which is called characteristic X-ray. So finally we have a spectrum like that, this spectrum which is called X-ray spectrum. This spectrum is very important because it gives us information about the intensity of X-ray and the energy of X-ray. So if you are adjusting the machine at 120 kV or 100 kV, that means the X-ray photon which coming out from the X-ray will carry 100 kV. This is the maximum energy for X-ray photons. As you can see here in the spectrum, the X-ray photons coming from the X-ray tube are polyenergetic, not monoenergetic. That means all X-ray coming from X-ray tube will not carry the same energy. Okay, it carry a range of energies, but the highest one is the value which already adjusted or pre-adjusted by our technologist. By changing kV, so at that time you are increasing the intensity of X-ray, and as well you are increasing the energy of X-ray. So by increasing the energy, you are increasing the patient dose. By increasing MAS, okay, milliampere current, so at that time you are increasing only the intensity of X-ray without any change in the energy of X-ray. So be careful about adjusting the KV, because don't use the adult protocol in case of child, in case of baby, because at that time you are exposing this baby or child to very high dose of radiation. Actually, we have many applications for man-made source like linear accelerator. We are using different types of energies up to 10 millielectron volt. It might exceed 10 millielectron volt in case of using 10 millielectron volt. That means there is a probability of neutrons productions. Okay, due to the interaction happen between the X-ray and the volt itself. So be careful about that. In case of using linear accelerator, so you have to make sure that the shielding design is going properly and there is no leakage of radiation, and that's important that all work in radiotherapy department in a controlled area, highly protected from any radiation leakage, especially if you are going above 10 millielectron volt. That means there is a probability of neutrons productions. Okay, in radiology department, we are using X-ray machines. Okay, at that time you are using very short time of exposure and using kV up to 120 kilovolt. Also, we are using fluoroscopic machines. This is a continuous exposure, okay? And we are using continuous exposure. We are adjusting the high kV, but with very less milliampere. But at that time, you are doing continuous exposure. It's pulsed exposure or continuous exposure. It's not like 2D image for X-ray. This one is called dynamic imaging. We can use this technique for cardiac angiography as an example for that, or many implants. Actually, fluoroscopy is the highest hazard, has a highest hazard among all radiographic machine or radiographic procedures. Computed tomography. Computed tomography, actually, we are using our CT machine, okay, up to 140 kilovolts. So as you can see here, we are talking about kilovolt, but in near accelerator, we are talking about million electron volt. But in CT, actually, we are scanning the patient, okay, and the patient himself get uh, receive a dose. It might reach to 100 milligray. In case of CT for multi-scans, CT like portography or CT multi-triphasic. So at that time, we are scanning the patient with very high dose. So be careful about that and watch the dose quantities very well before doing the scan. Many application for that one, angiography, 3D. We can get different plans for the patient. We can get many cross sections for that one, axial coronal, sagittal, especially for coronal angiography and aortic angiography as well. Okay, mammography is also the machine as a type of man-made source. We are using KV up to 35 kilovolt, which is not high, but the only issue is mammogram. So you are working in a controlled area, so you are safe because the mammogram you are using weak energy of X-ray, but this is used for cancer detection in the breast. For dental, the only issue with dental, we are using a very low KV and very low exposure time. The only issue is that we have many cases of patients, okay, we are doing every day. So the accumulated dose will be a little bit high. So be careful about that if you are working in dental department, okay, to follow the radiation safety measures to keep yourself away of any probability of cancer. In panoramic X-ray or CBCT, already you are on control area. Don't worry about that. But the only issue you have to put your eye on it, okay, is this using intraoral machine, as you are inside the room with the patient, so you have to follow radiation safety measures there. Okay, so let's talk about the natural source of radiation. Let me ask you, what is the cause behind the radioactivity of any radioactive material? Why we have radioactive material in this world? You have any idea?
Yes.
Why? Do you have an answer? Actually, any material
Just
composed.
come.
Sorry? Okay. Any material composed of atom. Inside the atom, you'll find the nucleus. Inside the nucleus, you will find proton positive charge, neutrons has no charge. So, inside the nucleus itself, if there are excess number of protons, that's mean high positive charge, all of them together at same place. So positive charge and positive charge cause repulsion, so the atom itself become unstable. But if there is excess number of neutrons, so at that time many neutrons inside. So there is also repulsion force coming from the quarks inside the neutrons. As the neutron itself is composed of three parts. You will find three parts or three particles inside the nucleus itself, or inside the neutrons itself. This quarks has a charge. Quarks itself, okay, repel each other. Okay, so at that time, okay, you will get repulsion force if there are excess number of protons or there is excess number of neutrons. So we have a balance should be done between number of protons and neutrons. This balance, it's related to the number of protons to neutrons and number of neutrons to protons. So if there is imbalance between number of protons and neutrons, so the atom become radioactive. So it become high in high energy state. So the atom tends to be more stable. Usually the atom tends to be more stable. How it comes, or how it how it go through this procedure to be more stable? By conversion of proton to neutron or neutron to proton, to make the more balance between, not ratio between the number of proton and neutrons. So now the cause of the cause behind the instability of the atom is the imbalance between number of proton and neutrons. So the atom tends to be more stable by conversion of one proton to neutron or one neutron to proton. So by conversion of one proton to neutron, so at that time, if there is excess number of proton, so the atom itself will emit alpha particle if the number of protons exceed 83. So at that time, if the Z number, there is something which is called for any material atomic number and mass number. This atomic number is the number of protons inside the atom itself, and mass number is the number of neutrons plus number of protons. Okay, so if the atomic number of the number of protons exceed 83, that means there is a probability of alpha decay. Alpha decay means that emission of alpha particle, we are talking about particle. Particle mean that we are talking about heavy charged particle has a charge +2. This particle has a mass and has a charge. When it moves from the atom itself, it interacts with all atoms around, and it causes ionization. So it deposits all its energy in a very short distance. That's why we are using many source of radioactive material for therapy. We are like actinium, okay? We are using radioactive source emitting alpha particle to be injected inside the patient, to be targeted to the tumor. At that time, it's labeled inside the tumor and going through the tumor and deposit all its energy inside the tumor, because it emits alpha particle which deposit all its energy inside the tumor. So this alpha particle make a lot of ionization with DNAs there inside the tumor, cause cell apoptosis or cell damage. Okay, so put on your mind, if you have a source of alpha particle, that means this alpha particle is a heavy charged particle. It cannot penetrate or it cannot move long distance. Why? Because it has high ionization density. That's why alpha particle is called high LET, high linear energy transfer particle. That means the amount of energy deposited per unit of length is very high. So alpha particle is a type of radiation. It's a particle radiation, has a high energy, high deposition, uh, high energy deposited per unit of length. That's why it's called high LET, high energy transfer, high ionization power, but low penetration power. So there is difference between ionization power and penetration power. If you have high ionization power, that means you interact with all atoms around you. That means you will be stopped shortly. But if you don't have high ionization power, that means you will not interact with all atoms around you, so you can move longer. Is it clear for everyone? Okay. Also, if you have an excess number of protons, but your atomic number doesn't exceed 83, so proton will be converted to neutrons. Sorry. And proton will be converted to neutrons by emitting positron. These positron, all of us hearing about positron emission tomography, PET-CT. Did you hear about it? For sure you hear about it, okay, because you are working in radiology. So at that time in PET-CT we are using FDG, fluorodeoxyglucose. This FDG, it's a positron emitter. FDG or F18 emitting beta plus or positron, as it has an excess number of protons, so it will convert one proton to neutron, so it will give. So by conversion of proton to neutron, it will produce beta plus or positron, which combine with electron to give us two gamma photon 180 degree to each other. Each one has an energy 500 electron volt, so it can be detected by PET scanner to give us the image of patients and to give us information about the tumor localization and tumor activity as well. If there is excess number of neutrons, that means neutrons will be converted to proton, so electrons will be emitted from the atom, which is called beta minus. Beta minus, actually, it has a middle ionization power and it has a middle penetration power, okay, among alpha particles and X-ray gamma ray. So be sure about that. Beta minus can be used for treatment like alpha particle because it's a charged particle, has a -1 charge, so it can be used for treatment as it can deposit all its energy inside the tumor itself. That's why we are using iodine 131, which is a source of beta minus particle, which can be used for thyroid cancer treatment. Okay, we are injecting or we are giving the patient iodine 131 capsule, which is radioactive, so it can be accumulated inside the thyroid itself, and it can deposit all its energy there, so it will destroy the tumor. Gamma decay, actually gamma radiation, it's following alpha particle beta minus beta plus decay. So gamma radiation, it's like X-ray, they have similar properties. So both of them have similar properties. It has high ionization, has less ionization power and high penetration power. So both that in your mind. If you are talking about X-ray, gamma ray, it can penetrate several meters, okay, with less ionization. That's why we are using gamma radiation. We can use X-ray for imaging, not for treatment. So in brief, or briefly, we have alpha particle, two protons plus two neutrons, helium nuclei, charged particle plus two, high ionization density, and low penetration power. Beta particles, electrons or positron, charged particle, low ionization density. Gamma ray, X-ray, electromagnetic waves, photons, low ionization density, high penetration power. So for gamma ray or X-ray, it can be only stopped by lead or high density material. Okay, for alpha particle, it can be stopped by thin sheet of paper. For beta particle, it can be stopped by low density material, aluminum or perspex. Don't try to stop beta particles with lead or high density material. It will cause premature X-ray and it will cause high scatter radiation at that time. Okay, so distance travel in the air by alpha particle. If you have alpha particle source, so the distance traveled by alpha particle from 1 to 10 centimeter upon collision with the patient body, it will travel to several tens of micrometers. Beta particles, it can travel several meters depending on the amount of energy. Upon collision with the patient, it can travel only several millimeters. X-ray, gamma ray, it can travel several tens of meters depending on the amount of energy, but upon collision with the patient body, it can travel several centimeters. Actually, we have many applications for natural source of radiation using we have PET-CT, we have SPECT-CT using radioactive material like gamma camera technique or PET-CT. We are using gamma camera machine for injecting the patient with radioactive material which localized in a certain organ to be scanned or to be imaged, to get an image finally to give us information about the kidney, for example. As you can see here, renal function, we can detect it, okay, or we can see metastasis for bone, okay, after following a patient with prostate cancer or breast cancer. Also, we can fuse the image between PET and CT, so we can do better localization for the tumor. Here, by injecting the patient with FDG, we are giving the patient FDG, which is biodistributed well inside the patient and will be accumulated in the tumor, which has high glucose uptake, so it will emit radiation in 180 degree to each other to gamma photon. Each one has 511 kilo electron volt to be detectable by PET scanner. So we are using PET-CT. This is the image of PET only, so you cannot define exactly where is the tumor, but using CT to get a fused image to know for better look. That's why we are using CT for better localization. Okay, how can I protect myself from radiation using a LoRa principle? If you ask anyone working in radiation field, what's a LoRa principle, he will say, as low as possible, reasonable, achievable. Okay, what does it mean? That means you have to avoid any unnecessary radiation exposure by time distance shielding, TDS. So you have to avoid any unnecessary radiation exposure. For example, for you or for patients, if you are adjusting the scan time to be 1 minute, but you are able to do the scan time to be half minute, that means you are exposing the patient to unnecessary radiation exposure. If you are not wearing the lead apron during the radiation exposure, so that means you are exposing your body to unnecessary radiation exposure. But if you are wearing the lead apron and you get exposed to radiation, this is necessary radiation exposure. So the main idea or the main concept of ALARA principle to avoid any unnecessary radiation exposure by spending less time, by keeping a distance away from any radiation source, using the proper shielding material, okay, during handling the radiation or during radiation exposure. Is it clear for everyone?
Yes, thank you.
Okay, great. So now, during the fluoroscopic procedure, you are exposing, we have X-ray tube and we have image intensifier or image receptor. So at that time, if you are close to the X-ray tube, so you will get a higher dose than distant away from the X-ray tube. So by inverse square law, which states that the intensity of X-ray is inversely proportional with the square distance. So if you are at 1 meter, you will get 100 meter Roentgen per hour, for example. So if you double the distance, you will get quarters the dose. So be careful you are away from any radiation source, as the distance is a main significant factor to reduce the radiation intensity for you and for patient as well. Here there is an experiment happened before. You are using this phantom and we are putting irradiation detector, and now we will put this patient away and close from the X-ray tube. This is a CR machine and we can read here in this monitor the radiation dose or the entrance dose received by the patient's skin. Okay, so if you are moving the patient close to the X-ray tube, for sure the patient will get high dose. So you will find the difference between positioning the patient close and away from the X-ray tube, the difference is around 50%. So be careful about that if you are working in fluoroscopic, if you are working in fluoroscopy rooms, or if you are working as an IR. Okay, so now you can find that the reading here is up to 800 microgram per second at the dose rate, at the entrance dose rate. So if you are moving the patient away from the X-ray tube, this will be around 400. Okay, so now anyone here working in interventional radiology? Okay, okay. I was about to focus on this part if there is one here working in interventional radiology. Okay, source shielding. As you know very well, we are using shielding material, okay, with a specific thickness to reduce the radiation or to reduce the radiation intensity received by our body. Okay, the most common one, which can be used for radiology and other departments, the lead apron. Do you think the lead apron is effective to reduce the radiation intensity received by your body? Do you think that? Actually, yes, it's 99% reduction in radiation dose. You can imagine this experiment happen using a lead apron, and it reduced the radiation intensity received by our body to 90%. This thickness, the thickness of overlap lead apron, okay, is zero point 0.5 millimeter as a total thickness. So each one, okay, is 0.25 millimeter. So overlap one is zero point 0.5. Here without lead apron it's 646.5 microsievert per hour. Okay, but using lead apron it reduces the dose to 7 microsievert per hour, which is 99% reduction. So be sure that you are wearing the lead apron, and should be screened well, should be hanged properly, should be screened annually, and should be reported, as functional inspection will come and check if it's labor or not, if it's screened or not, and if it's recorded the results for screening report or not. Okay, sometimes you find patient comes to your department and you are going to do X-ray for feet or X-ray for chest, and you are covering the sensitive organs of the patient with lead apron. And if you didn't do that, the patient will be angry with you. I think all of us face the same issue. But do you think this lead apron is sensitive or it's effective to reduce the radiation exposure to the sensitive organ? You might be shocked. Okay, you may be shocked to hear that the answer is no. The American Association of Physicists in Medicine, AAPM, and ACR, American College of Radiology, no longer support using radiation therapy for imaging exam. Why? Because most of X-ray beam now come from X-ray tube highly collimated. That means there is no scattered radiation except the internal one. You'll find the internal X-ray which come or incident on the patient would be internally scatter inside the patient. There is no scatter radiation from outside, so it will not expose the sensitive organ to the patient except from internal side. So it doesn't make any sense to use the lead apron, but the patient will be angry with you. So I don't prefer to tell the patient I will not use this one, but you have to be sure 100% that's not significant anymore. Don't try to wash the lead apron. Hang it properly. Okay, at that time, if you wash it, it will be cracked and a lot of voids will be there. So you will lose around $1,000. Okay, this part is clear for everyone? No questions?
No, thank you.
Okay. I'm running or you can catch me well.
Just okay.
That's fine. You can catch me. Okay. Okay, so radiation units and measurements. You can ask yourself if I'm going to measure the radiation itself, like your weight. If you're going to measure your weight, so you have to use weight scaler and you will get mass of the weight, so you can find a certain unit which is called kilogram. So at that time you are measuring your weight using a certain unit, same like radiation. If we are using radiation, so we have to measure how much dose received by your body, how much dose you get exposed to, how much dose already already absorbed by your organ or by your body. So how can I do that? Actually, we have radioactive material now. This radioactive material emitting radiation everywhere in isotropic way, but you have to ask yourself the emitting of particles or waves, that means there is a decay happen. This decay happen as one unstable atom converted to stable atoms. So at that time, it will decay, it will emit a certain type of radiation. So that's called radioactive decay. So if the material going through or doing 1 decay per second, that's mean it has an activity 1 becquerel. So the becquerel is the unit of decay rate. So if you said that the activity of radioactive material is becquerel, that means that each second the material will convert one atom from unstable state to stable state. So now the radiation coming out from the radioactive material will cause ionization in a certain area of the air. So the ions will be produced here. These ions which are produced, okay, we can measure it. If we measure it, it will give us information about how many charges we have per kilogram of air. So at that time it's called exposure dose. So the exposure dose give us information about how many charges will be collected per unit of air or per unit of mass of air. So at that time it's called exposure dose. Okay, so this exposure dose has a certain other unit which is called Rontgen. So now the radiation incident inside your body, incident on your body. So at that time you can ask yourself, I didn't receive or I didn't absorb all this amount of radiation. So the absorbed dose definitely will be different than the exposure dose. And we have to calculate how much energy will be deposited inside your body. So the energy deposited by your body, by your unit of mass, so it will be joule per kilogram as a unit. So the unit will be gray. So the absorbed dose as a unit is gray. So now we calculate the dose which you received by your body. But the question is, we have different types of radiation. Not all types of radiation have the same effects. Alpha particles has high ionization power, so it will deposit all its energy in a very short distance. So it has a greater effect than X-ray or gamma ray or beta particle. So we have to consider that in our calculation if we want to calculate exactly the received dose by patients or received dose by our workers. So we have to consider that in another definition, which is called equivalent dose. So the equivalent dose is absorbed dose multiplied by radiation weighting factor. This radiation weighting factor is 20 for alpha particle, is 1 for X-ray, gamma ray, and beta particles. So equivalent dose give us information about how much dose received by patient or by worker, okay, considering the type of radiation. Also, not all organs inside your body have the same sensitivity to radiation. You will find the reproductive organs like stomach, like testes, like ovaries, have more sensitive, have high sensitivity than or higher sensitive than other organs. So the effective dose should be calculated here to consider the sensitivity of tissues itself. So we have to multiply the equivalent dose by tissue weighting factor, which give us information about how much the organ is sensitive to radiation. So that's why your reading, which comes to your department every month or every quarter, okay, give us information about the effective dose, okay, and you can measure or you can exactly know how much dose received by your body, considering the type of radiation and considering the tissue sensitivity factor as well. So now we have an activity. Activity means that number of nuclei of radionuclide decaying per second is known as an activity, okay? So the unit of activity is becquerel, which means 1 disintegration per second, 1 decay per second. The old classical unit is curie. 1 curie is the activity of 1 gram of radon equilibrium with its daughters. So 1 curie is equal to 3.7 10 to the power 10 becquerel, okay? We have something which is called time half-life. Time half-life is the time required for the amount of radioactive material to decrease by 1/2. So if we have radioactive material, it has a half-life is 6 hours. For example, we are using technetium 99M. So for technetium 99M, if it has an activity 100 millicurie, so after 6 hours it will be 50 millicurie. After another 6 hours it will be 25 millicurie, and so on. So after a certain half-life, you get half number of atoms, you get half number of decay rate, or half number of activity. So be sure about that. And this is a specific property for each material, okay? Okay, so now we will exposure rate. As I informed you before, the quantity exposure describes an X-ray or gamma ray field. It's a measure of amount of ionization produced in air by the X-ray or gamma ray in air. Exposure is defined as the amount of a charge of either kind produced by X-ray or gamma ray in 1 kilogram of air when all the charges, positive or negative charges, are stopped in the air. As I informed you before, units of exposure coulomb per kilogram, it has also another old classical unit which is called Rontgen. What Rontgen is 2.58 10 to the power minus 4 coulomb per kilogram. Okay. Absorbed dose, energy per unit of mass, it has a unit gray. So we are talking about gray, we are talking about absorbed dose. If we are talking about sievert, we are talking about equivalent dose or effective dose. Sievert, okay, we are in equivalent dose, we are considering the radiation weighting factor, radiation type, okay? And in effective dose, we are considering tissue weighting factor. As you can see here, you will find different weighting factor or different sensitivity based on the organ type. And here we have radiation weighting factor, different radiation weighting factor based on the type of radiation itself. Okay, so now we finish the radiation units and measurements. No questions?
No, thank you.
Okay, great. So now how we can measure this one, we are using radiation dosimeters or radiation survey meters. As you can see here, you are using TLD badge or electronic dosimeter in your department to measure exactly how much dose received by your body. We are using survey meter, okay, for measuring the leakage of radiation or background radiation, which is highly sensitive and give you instant reading. But using ring dosimeter, we are using it if you are handling the dose by your hand, if you are working in nuclear medicine department or fluoroscopic procedure and your hand get exposed to radiation, so we can use the ring dosimeter for that one. TLD badge is only used for whole body exposure, so we can use it, okay, for this purpose, and it's highly sensitive, okay, to the radiation. And you will find each TLD badge has a certain number and serial number, and as well you will find your name already mentioned there, and which is specific for each one. If you are a new employee and coming to the department, you have to wear a new TLD badge, and a radiation safety officer should order that. Should order one for you. If there is no one under your name, you can wear a spare TLD badge for a certain time. And next time when we receive the TLD badges, he should bring one for you under your name. That's important. You should. If you are wearing the lead apron, you should wear the TLD badge under the lead apron to give you the actual dose received by your body, not over the lead apron. If you are wearing the TLD badge over the lead apron, that means you are measuring the dose for the lead apron itself. But that's not right. That's an option. But the mandatory one to use the TLD badge under the lead apron, not over the lead apron. If you are pregnant, at that time you have to declare that to the radiation safety officer, and you have to wear a TLD badge which fixed or which position on your pelvis region. Each radiation worker must collect his or her TLD badge from the designated place before the start of his or her duty in the X-ray facility and leave it at the designated place after completion of them. Don't try to put it in X-ray room. Don't mess it there. Keep your TLD badge away of any radiation sources. Don't try to take your TLD badge to your home. Don't try to do that, or to another institute. Don't borrow your TLD badge from another person. If your TLD badge missed, you have to declare that to the radiation safety officers. That's important, because if you miss it, you can miss it inside the X-ray room itself. That if you discover that after 2 or 3 days, so definitely the TLD badge reading will be very high at that time. So if the dose exceeds the dose limit, you should report that to FANR, Federal Authority of Nuclear Regularity, immediately, and you will be stopped to work, okay, until we do investigation and see what's happening. Okay, we are using survey meter to check the leakage, and also we have area monitors here. That one which give us the background radiation inside our rooms of X-ray or outside in the control area to check if there is any leakage or the dose or the exposure rate exceeds the background radiation. We'll talk about the biological effect. Okay, I want you to imagine something. The lethal dose of radiation is 4 gray. If you receive this dose, you will die. Okay, definitely, don't worry about that. But the only issue we have is that now that the lethal dose of radiation give you the same energy of 1 sip of coffee. If you are drinking 1 sip of coffee, you will get around 69 calories. These calories, okay, come from the same lethal dose of radiation. By calculation, as you can see, 69 calories come from 1 sip of coffee. Same energy will come from the lethal dose of radiation. So what's the difference? So now I can drink coffee and I can die by end of my cup? No. Why? Because the only difference is the effect itself. If you are dealing with radiation, so particle radiation or X-ray or gamma rays, it will cause ionization inside your body. These ions will attack your body. We have two different mechanisms. We have direct action and indirect action. If we are talking about direct action, this is an interaction happening between the radiation and DNA itself. So there is no particles in between. There is no moderators. This is a direct action between the radiation and DNA itself. It happens with alpha particles, beta particles. While X-ray gamma ray, it's indirect action. It's following indirect action as it causes interaction between the X-ray gamma ray and water molecules. So at that time, it will produce hydroxyl radicals, which attacks the DNA by itself. So this is the difference between direct action and indirect action. So both type of radiation or particle and waves radiation cause interaction with DNA, but X-ray gamma ray following indirect action, alpha particle, beta particles following direct action. Okay, I miss this part. It's not important. Okay, so now every day your DNA get damaged. Every day, you can imagine that. Every day your DNA get 1,000 to 1 million location get damaged. Okay, so 1,000 to 1 million locations inside your DNA damage every day, and the cell itself produce repair enzyme trying to fix all of them. Finally, it succeeds. But if there is something happen or it doesn't succeed to repair the damage, it might cause mutation or cancer, or it might cause cell death. So now, if you get exposed to radiation, you will increase the number of damages happen to the DNA. So now the mission of repair enzymes will be more hard to fix all these errors. So now by exposing your body to radiation, so you are increasing the number of damage having to use the DNA. So now if the repair enzyme succeed, so no other will be there. If repair enzyme fail, so cell death or cell degeneration. So this might cause acute effects and fetal effects. If incomplete repairs, that means mutation might happen and there is possibility of causing cancer and hereditary effects. So put in your mind that radiation, if it exceeds a certain value, 100 milligray, so it will cause a deterministic effect of radiation. Deterministic effect means that the dose increase, the severity increase, the effect or the severity of the effect increase, and cell death at that time will be happen. But below 100 milligray, there is a probability of another effect which is called stochastic effect or probabilistic effect. This stochastic or probabilistic effects, it's not dose dependent. It's not dose dependent, okay? The probability increase by increasing the dose. So now, by increasing the dose, you are increasing the probability of cancer and genetic disease. As cancer and genetic disease as a type, or leukemia as a type of stochastic effect, while cataract, hair loss, skin burn, tissue damage, all the sterility, all this under deterministic effect. So now, if I have a patient going to do X-ray chest, do you think this patient might suffer from sterility? No, definitely no. Why? Because the received dose by patients, okay, will be very low, will be 100, less than 100 milligray. And for sterility as a type of deterministic effect, it requires 3.5 gray to cause sterility to anyone. So it will be never happen there, and it's impossible to be happen to anyone, even for ours as a worker in radiation field. Okay, don't think you will get sterile or you will be infertile because of radiation exposure, because you are getting exposed to low doses of radiation. So don't worry about that. But the only issue you have, and should be curious about it, is cancer and genetic disease, especially if you are young. So we are avoiding any unnecessary radiation exposure because of we are worried about cancer. We are worried about genetic disease as a type of stochastic effect, as one photon might cause cancer. There is no, this interaction or this effect is not dose dependent. One photon might cause cancer, while deterministic effect for skin burn, hair loss, it might happen only for patient under fluoroscopic procedure or patient under radiotherapy techniques. But for patient for X-ray, for CT, for nuclear medicine, it never happen for any one of them because all of them receive dose less than 100 milligram. Is it clear for everyone?
Yes, thank you.
Okay, great. So now the interaction happen between the radiation and the patient or your body. Okay, in 1,000 of second after irradiation, DNA breaks happen and base damage occur. In a second after irradiation, DNA repair start. And if the repair fail, cell death and mutation occur within an hour to 1 day. It takes some time until such reaction at the cell level develops into clinical symptoms at an individual level. This period is called incubation period. Effects due to which symptoms appear within several weeks are called acute or early effects, while effects that develop symptoms after a relatively long period of time are called late effects. In particular, it takes several years to decades until a person develops a cancer. Okay, so this is a rapid comparison between stochastic and deterministic effect. So if I ask you cataract, hair loss, skin injury, all these deterministic or stochastic? Deterministic. Cancer, leukemia, hereditary effects, deterministic or stochastic? Stochastic. That's mean leukemia, hereditary disease, cancer. One photon might cause cancer. This is not dose dependent. Why deterministic? It's dose dependent. Severity of the effect increased by dose. Excuse me. Sorry. Indeterministic effect. While stochastic effect, the probability of the effects increase by dose. Okay. So now, can the patient become sterile after undergoing diagnostic X-ray? For sure, no, because as diagnostic X-ray examination involves small doses, and the gonads are radiosensitive organs in the human body, the threshold radiation dose for pregnant sterility in men is 3.5 gray to 6 gray, and for women, 2.5 to 6 gray. Can pregnant embryo continue to work in the X-ray department? Do you think that? Pregnant worker can continue working in the X-ray department as long as there is reasonable assurance that the fetal dose can be kept below 1 milligram during the pregnancy. Actually, this is the main point. If the pregnant embryo work in a certain area and she is sure 100%, and the radiation safety officer also sure that her work will not expose her to dose exceed 1 milligram during the pregnancy period, she can continue this work. Like she's working as a nurse in radiology department. She is away from any radiation sources. But if she is working fluoroscopy with fluoroscopic procedure. So at that time, she will get a high dose of radiation. Definitely, she will exceed this period, will exceed this limit. So we have to be careful about that, and we have to evaluate the situation very well. If you are working nuclear medicine, and she's going to the hot lab with handling radioactive material, definitely she will exceed this value. So based on that, the type of work, workflow, okay, you can take three decisions. You can take one of the three decisions. First one, no change in assigned working duties. Second one, change to another area where the radiation exposure may be lower. Third one, change to a job that has essentially no radiation exposure. And this should be done under agreement between the employee and employer, both of them. And by law, we cannot enforce the employee to do one of them. Should pregnancy be? Oh, yeah, this is important question. Sometimes, as a radiologist, or you are female and you are working in fluoroscopic procedure, for example, yesterday, and you discover today that you are pregnant. Okay, shall I do termination for my pregnancy? What do you think? If patient come to your department and he did CT abdomen and pelvis, and she discovers that she is pregnant after 1 week, shall she do any termination for pregnancy? Anyone has an answer for that? All of you work in radiology department. Do you think, did you take any decision regarding pregnant patients to do abortion?
This is something that should be discussed depending upon the amount of dose, together with the circumstances of the patient and together with OB-GYNs.
Perfect. It's a good answer. Actually, as you said, as you mentioned, based on ICRB 84, we have to estimate the fetus dose. That's the beginning, okay? And after that, if the dose less than 100 milligray, so no recommendation for termination of the dose. But if the dose exceed 100 milligray to 500, so it's up to the patient's circumstances, up to the patient beliefs and ethics. If the dose exceed 500 milligray, so fetal damage is a significant, and it's recommended to do abortion at that time. So first of all, we have to call our medical physicist. Please come, estimate the patient dose, and we have to do that. Okay, if it's less 100, no worries. Up to 500, so it's up to the patient's circumstances. But significant fetal damage will be happen after 500 milligray. Also, you have to put in your mind that the radiation effects for pregnant or for fetus based on the period itself and the radiation dose. If the period itself is from 0 to 2 weeks after conception, it's called all or none period. Miscarriage might happen there. Only miscarriage. So if there is no effect, that means the pregnancy will continue. So there is no probability of cancer. There is no probability of malformation. Okay, as there is no organs start growing yet. There is no brain start growing yet. So don't worry about that. So if you normally, all patients will not discover that they are pregnant. Okay, at the first 2 weeks. Okay, so at that time there is no organs start growing yet. There is no brain start growing yet. So no risk for malformation, no risk for mental retardation. Don't worry about that. And if there is something wrong, the abortion will happen or the miscarriage will be happen normally. So if your pregnancy continue smoothly, you can continue your pregnancy without any worries. But if you get exposed after 2nd week, from 3rd week to 8th week, so at that time organs start growing up, so malformation might happen. Okay, and from 8th week to 15 weeks, from 9th week to 15 weeks, so at that time central nervous system start to grow up, so mental retardation might happen there. For late fetal period, 15 weeks after conception to delivery, so cancer might happen there at that time. So based on the period, based on the radiation dose, the effects will be happening. The threshold dose is 0.1 gray, which is 1 milligray. I said 1 milligray, it's equal to 0.1 gray, okay, for the remainder of pregnancy period. Okay, we answered these questions. Okay, do you know something about 10-day rule or 28-day rule? Actually, we have 28 days rule that states that you can do any procedure for any female from the onset of menstruation up to 28 days. Okay, any procedure except CT abdomen pelvis, barium enema. Okay, you cannot do that for any patient. CT abdomen pelvis for any scan. You can't do any scan except for pelvis region, for abdomen pelvis region. So this is called 28 days without any pregnancy test from the onset of menstruation. No worries about that. But in case you are going to do for pelvis region or CT abdomen pelvis, you have to stick with 10-day rule. You have to count from the onset of menstruation 10 days. So at that time, you can do any procedure, including pelvis region as well. You can do any radiological examination for chest, extremities for pregnancy. How safe? Yes, it's safe. After justification, you can do that. No worries about it. Even cardiac catheterization, after justification, you can do for any pregnant patients, okay? But you have to justify the case first. If it's mandatory, it cannot be delayed, and you can do that. And you have to reduce the acquisition parameter to optimize the dose for the patient and for pregnant. Okay, so now we will talk about occupational and public dose limits. As per final regulation 4, okay, Federal Authority of Nuclear Regularity, which this is the organization which monitoring the radiation protection rules and radiation protection work in United Arab Emirates. So now, as a worker, the average dose limit is 20 millisievert over 5 years as the average dose, and 100 millisievert for 5 years, 50 millisievert as 1 year as a maximum dose. Person between 16 and 18 years of age, maximum dose is 6 millisievert per year. For length of eye, for worker is 20 millisievert over a period of 5 years. For 5 years, 100 millisievert as a maximum. 1 year, less or equal to 50 millisievert. Person between 16 and 18 years of age, for 1 year is 20 millisievert. Any point of scan, now we are talking about scan or extremities, which is less sensitive to radiation. You will find the radiation dose limit for hand is 500 millisievert. For person between 16 and 18 is only 150. For worker is 500 millisievert for extremities like hands, feet, forearms, okay? And 150 millisievert for person between 16 and 18 years old. For fetus, that's important, is 1 millisievert reminder of the pregnancy period. Remainder of, yes. For public is 1 millisievert. For length of eye for public is 50 millisievert. Any point of scan for public is 50 millisievert. There is something which is highly conservative, and we can use it in shielding calculations and as an investigation level. If we exceed this level, so we have to do investigation. This is called dose constraint. The dose constraint itself, okay, it's mentioned in final regulation 24, and for worker in radiotherapy and nuclear medicine, the dose constraint is 6 millisievert per year. So you have to make sure that you are not exceeding this value. And if you get this value, if you reach to it, so investigation should be done. For diagnostic radiology, 3 millisievert per year. Okay, for diagnostic radiology, 3 millisievert per year. So per month, if you are working radiotherapy or nuclear medicine, 0.5 millisievert per month. For diagnostic radiology, 0.3 millisievert per month. For hand or finger dosimeters, okay, it's 5 millisievert per month. For female workers, okay, in any practice who are pregnant or breastfeeding, 0.1 millisievert per month. I think all of you are aware of radiation signage. Okay, so be careful if you see this signage. You can ask before going inside the X-ray room, and you have to take a permission to go inside it. Thanks so much. Hopefully you get satisfied today.
Thank you.
Any questions? Okay, I will share with you the exam. Okay, I already sent the exam, okay, in the chat box. Okay, I try to be more focused on going through many physics details. So if you have any question, please don't hesitate to ask me. Okay, great, perfect. Okay, you can start now. You can start now with the exam. Okay, that's mandatory to get your certificate. Okay, thanks so much. Have a nice day, and wishing you all the best in your life and career. Okay, and to be happy with radiation safety. Thank you. Goodbye.